Next structure I will talk about is the styloid process. In this figure, styloid process is this. The styloid process of temporal bone is a slender, pointed pieces of bone that is a process of bone that extends down from the temporal bone of the human skull just below the ear. The styloid process lies anterior and medial to the mastoid process, and it gives attachment to several muscles and ligaments, such as you should remember this. Number 1, stylohyoid ligament, and number 2, stylomandibular ligament. These two ligaments and styloglossus, extrinsic muscles of tongue, and stylohyoid muscle, one of suprahyoid muscle, and stylopharyngeus muscle, one of elevator muscles of pharynx. So 2 ligaments and 3 muscles are attached to this process. Its base is partly incised by tympanic plate. You cannot see in this figure clearly, but usually it is incised like that, which is called vaginal process. In fact, there are many vaginal processes in human skeletons. And it descends anteromedially, its tip usually reaching a point medial to the posterior margin of the mandibular ramus. Its size is variable, but it nearly reaches the posterior border of the mandibular ramus. This is the mandibular ramus. And in reality, the styloid process is very variably developed. Its length ranges from a few millimeters to a few centimeters and increases with age. And it is related with Eagle syndrome, an elongation of styloid process, and ligament calcification. To mastoid process. The mastoid process of temporal bone is located posterior and inferior to the ear canal, lateral to the styloid process, and appears as a conical or pyramidal projection. It has a variable size and form and is usually larger in the male than in the female. It is filled with sinuses or mastoid air cells. Inside the mastoid process, there are many mastoid air cells. This process serves as a for attachment of 4 muscles, all of which will be covered later in this Pilldok anatomy. I will write down the 4 muscles which attaches this process. First is the sternocleidomastoid muscle, very famous muscle of the lateral wall of the neck. And in the name, there is a mastoid in this muscle. And the posterior belly of digastric muscle, and splenius capitis, to finally the longissimus capitis. This process is contact behind with the posterior inferior angle of the parietal bone at the parietomastoid suture. This is a parietomastoid suture. And with the squamous part of the occipital bone of the occipitomastoid suture. This is the occipitomastoid suture. The next is the suprameatal triangle and the suprameatal spine. A small depression in the suprameatal triangle lies above and beyond the external acoustic meatus is related to the lateral wall of the mastoid antrum. More specifically, it lies between the posterior wall of the external acoustic meatus and the posterior root of the zygomatic process. Here and so. This is the suprameatal triangle's location. Through this triangle, an instrument may be pushed into the mastoid antrum. In this figure, from your side, some kind of needle can be pushed into the mastoid antrum, which is located below this triangle. Meanwhile, immediately below the posterior root of the zygomatic process, there is sometimes seen a small spine around here. The suprameatal spine, also called the spine of the Henle, situated at the upper and posterior part of the orifice. In the adult, the mastoid antrum lies approximately 1.5 to 2 centimeters deep to the suprameatal triangle. This is an important landmark when performing a cortical mastoidectomy. The triangle lies deep to the Simba conchae. Just for your information, the mastoid antrum, or it may be called as the tympanic antrum or valsalvas antrum, is an air space in the petrous portion of the temporal bone, communicating posteriorly with the mastoid air cells and anteriorly with the epitympanic recess of the middle ear via adductus to mastoid antrum. The adductus to the mastoid antrum is the entrance to the mastoid antrum. The next structure is a mandibular fossa. The mandibular fossa, which will be discussed in more detail in the part of the temporal mandibular joints, is a depression in the temporal bone that articulates with the mandible. It accommodates the mandibular condyle. In this figure, we can find the mandibular fossa here. The mandibular fossa is bounded in front by the articular eminence. This point is the articular eminence, and behind by the tympanic plate. Sometimes more specifically post-glenoid process, which separates the mandibular fossa from external acoustic meatus. The fossa is divided into two parts by a narrow slit, the petrotympanic fissure, Glasserian fissure, which we cannot see in this figure, but we will discuss about in the inferior view of the skull later. The fossa is also referred to as the glenoid fossa in some dental literature. Articular tubercle. The articular tubercle is located where I drew the star-shaped mark in this figure. As the zygomatic process of the temporal bone passes posteriorly, it widens and forms the articular tubercle of the mandibular fossa anteriorly. Actually, this is the zygomatic process of the temporal bone, and here where the star shape marked, it widens to form an articular tubercle of mandibular fossa anteriorly. The articular eminence is rounded eminence of the anterior root of the posterior end of the outer surface of the schema temporalis. In other words, the schemous part of the temporalis muscle. This tubercle is in fresh state is covered with the cartilages. And the next structure is the articular eminence. In some textbooks, the articular eminence is used with the same meaning of articular tubercle. But strictly speaking, the eminence is located more medially than the tubercle and forms the front boundary of the mandibular fossa. Thus, it restricts the excessive movement of the mandibular condyle. The articular eminence provides a surface over the mandibular condyle glides during the mandibular movements. These structures will be explained in more detail in the temporal mandibular joint. As I said, the next structure is the post-glenoid process. The post-glenoid process is a small process of temporal bone separating the mandibular fossa from the external acoustic meatus. This black star is the post-glenoid process. The structure I will talk about is the well-known zygomatic arch. The zygomatic arch, or sometimes called as a cheekbone, is formed by the zygomatic process of temporal bone and very short portion, the temporal process of the zygomatic bone. These two processes are being united by an oblique suture, that is the zygomatico-temporal suture. The tendon of the temporalis muscle passes medial to the arch to gain insertion into the coronoid process of the mandible. The zygomatic arch stands proud of the rest of the skull, and the temporal and infratemporal fossa communicate via the gap. In real life, this space is largely filled by the temporalis muscles. As the zygomatic process of the temporal bone passes posteriorly, it widens to form an articular tubercle, as I said. In fact, the temporal bone, temporal region, can be divided into upper temporal fossa and lower infratemporal fossa, separated by the position of the zygomatic arch. High cheekbones are pronounced zygomatic arches, causing the upper part of the cheeks to jut out and form a line cut into the side of the face. High cheekbones forming a symmetrical shape are very common in fashion models and may be considered a beauty trait in both males and females, at least in Eurocentric societies. But as you know, the beauty is the eye of the beholder. The zygomatic arch is occasionally referred to as a zygoma, but this term usually refers to the zygomatic bone or occasionally the zygomatic process. Final structure we will discuss about is the zygomatic process of temporal bone. In fact, this is a major constituent to comprise the zygomatic arch that I described just before. This is the zygomatic process of the temporal bone. The zygomatic process of temporal bone arises by two routes, if we describe more strictly. The anterior route, this is the anterior route, directed inward in front of the mandibular fossa, where it expands to form an articular tubercle here, and the posterior route runs backward above the external acoustic meatus, and it continues with the supramastoid crest here. The upper border of the arch gives attachment to the temporal fascia. The lower border of the medial surface gives origin to the masseter muscles, one of the most important masticatory muscles.